So, hi everyone. My name is Marcia Fajardo. I just graduated last year from med school.
Alrighty, so our first question is, what are some barriers to care that you see for Colombian patients?
Well, it would depend on how you look at it, because I would say that the main barrier we have is that we have such a big amount of patients that need access to healthcare, but there are not enough of us that can provide the care they need. So some people wait an insane amount of time to get access to an appointment. And if you live very far away from central and big cities, you would have to travel 1 day, 2 days, even 3 days for an appointment. So for example, I once had a patient in Villavicencio, which I was previously, that she had to travel 4 days and she was in active labor. And thank God she didn't have the baby earlier. So they're like very high risk patients because you don't know the conditions they have to go through to travel. You don't really know what health conditions they have because they spend like 6 months waiting for an appointment, and then when they get it, if there's like diabetic patients and they have like a diabetic foot or something, it's very little we can do. So that's the biggest issue we have. Also, we don't have enough subspecialties like doctors. So sometimes we do need like someone very specific to like provide certain like service, and we don't have that person. So you need to like submit a form into the government so they can be moved to another city and they can like get access to the care they need. But we also need to make sure that in order to the patient be taken into another hospital, they need to have a place to stay, a place where they can receive food and stuff, and that's like pretty hard to get in my country.
So can you tell us a little bit about what the charting medical record system is like in Colombia?
Well, that mainly depends on if it's a public hospital or if it's a private hospital. So if it's a private hospital, each hospital has their own system they buy. They usually buy softwares from other countries. They just adapt it. But mm, the main design of it is just like general charting. I've seen like the differences between when I was charting in the States and when I chart here, and you guys get like little templates so on what everything is. We don't have here. We don't have that here. We do everything by hand or well by computer, but we don't have any templates. We do everything from scratch, which also takes us an insane amount of time. And for example, if it's a private hospital, we do get like a very high-end type of software. But if it's a public hospital, the software is just very slow, very hard to use. So if something goes wrong or you lose the network, you'll have to start all over again. And that is like an insane amount of time you lose. In rural areas from our country, we don't have access to computers and stuff. So everything is by hand. Like every medical history is kept in different records. It's everything by hand. You do everything, prescriptions and anything you can imagine to keep record of the patient. Everything goes by hand. And that's like a huge challenge because if there's a flood in that hospital, you're going to lose information. After you've seen so many patients, you tend to forget what you've had like ordered before. So like some people, what they do is like they do all the charting first and then they hand out like prescriptions, or some people just see all their patients first and then hand out prescriptions. Like it's just whatever fits best for you as long as you get the job done.
How many patients do you see in an average day, would you say?
That would also depend on first the area you're in, and it would also depend on what service you're in. So if I were to be in a rural area or a place that doesn't have like open access to healthcare, I would go in like little brigades from like 6 a.m. until like 7 or 8 p.m. And I would end up seeing like 100 patients. Or like it depends on how many people actually make it to the brigade. If I were to be like in just one sector, like if I was just doing surgery or something, and it's just like a mid-level hospital, I would see like probably 20 patients. But if it were to be like an ER service, I would see like 100 or even more patients because you see so many accidents here that they just keep coming in, and if you're in a very rural area, you see a lot of intoxications and like snake bites and stuff. So they just keep coming and they don't stop.
What do you most commonly take care of on any given day? And then what are the most common medications that you would prescribe?
But most common medications would be for high blood pressure. That's what we mainly prescribe. I wouldn't say like specifics because you usually have to check with every hospital what they have available, and you also need to check with the insurance the patient has, but because you need to make sure they can get the medicine. So we usually first check with that, and then we just prescribe whatever they can get access to, as long as it does like the same effect. We just try to make sure they can get the medicine, because if not, they'll never get like their condition treated. So mostly like high blood pressure, insulin, anything to control like either hypothyroidism. I don't know how you call it. I don't know how to say it. Either hypo or hyper, either both of them. So like always try to check first with like what kind of access they have, just so we're 100% sure they can get the medicine. Because if not, the whole consult will be a waste of time. If I were to be here in the capital in Bogota, I would mainly take care of disbalances with the thyroid or high blood pressure, or some people that just come in with a GI problem. That's like the three main things. But if I were to be in a rural area, I used to take care of a lot of gunshot wounds, a lot of stab wounds, a lot of hit and runs, a lot of snake bites, poison accidents. That would be like my day to day.
How do patients pay for medical care? You stated that they have insurance. Any, is cost a major issue for some of your patients? And if so, are there any ways that you mitigate your costs for patients?
Okay, so it would depend on what type of regimen they're affiliated to. I was explaining to Louise earlier that we divide our healthcare system into. So we have the private sector and the public sector. Public sector receives different amount of money from many given like sources, which goes then into a fund, and that fund redistributes the money into whatever the people need. So basically there's people that pay like a little quota that is like mandatory to be affiliated to. And that little quota helps to pay for healthcare for people that don't have any access, or like they don't produce enough money to. So that's why our healthcare system is known as the most solidary healthcare system in the world, because no one gets left out. So for example, if I were to need like an appointment or something, I would pay a copay that it's like 20,000 pesos, Colombian pesos. You could just later do the math for US dollars, but we would pay a copay of 20,000 pesos each time we go to the doctor. And that amount just gathers for other people to get access to. So we always keep that quota, and it depends on whatever the people need, but no one gets left out. So that will mean that even if you live on the streets, you'll always get access to healthcare. It doesn't matter what you have or what you don't have. It's a matter of how much can you pay and can you afford, so you get like a more high level of attention.
Which specialties in Colombia are in high demand?
ICU, like people that do like internal medicine, they're always very high on demand. Or anyone that works in the ORs, like surgeons or more specialized surgeons, anesthesiologists are also very high on demand. And right now, since we're like one of the capitals of plastic surgery, there's always like plastic surgeons needed. And we do have like, we've been getting like a lately an insane amount of cancer patients. So there's also like oncology, like patients that need access to healthcare and stuff, but there are like not enough doctors to evaluate so many patients.
Did you know about it before
No, I know it because you're my cousin. and he obviously explained it to me.
Yeah.
But before that, I did not know about this because here in Colombia, we don't have that like in between. So we just get an insane amount of burden of patients that we can't really look at because there's just so little time. So it would be cool to like get that because that would like we would all share the burden together.
And the same goes for like nurse practitioners. You guys also don't have nurse practitioners.
We don't.
So do you think Colombia would benefit from having mid-level providers? You think it would?
Oh, definitely. Because there will be more availability, which is what we don't have right now.